A new report finds that men in Canada are dying too young and by preventable causes. Movember Canada's report finds 2 in 5 Canadian men will die before the age of 75, which is considered premature. And 2 areas in Manitoba are seeing some of the highest rates in the country. Joining us now to tell us more about this report is Corriveau, the Director of Policy and Advocacy for Movember Canada. Good morning, Catherine.
Good morning. How are you?
I'm well. Thank you so much for joining us. Now tell us about this report and its findings.
Absolutely. So the report came out of the Institute of Men's Health, which is part of the Movember ecosystem. And the report, Real Faces of Men's Health, looks at the problem of premature death in Canada. So as you mentioned, too many men are dying too young of largely preventable causes. In 2023, that was 75,000 men in Canada. And so that in and of itself is a pretty drastic data point. And the report goes to show not just that this is happening, but the impact that this has. So there's an impact on the economy. Poor men's health cost Canadian taxpayers $12.4 billion in 2023, which is about 12 fully functioning major hospitals. There's an impact on caregivers, which tend to be women. It has an impact on our families, our communities, our sort of system as a whole, as we have a productivity crisis coming from it. And this is happening because of causes that we know, like stigma, gender biases, harmful masculinity norms. You know, we've all heard the term be tough or men don't cry. And all of that is contributing to a culture of silence, which is preventing men from seeking care in a timely manner. And those delays worsen health outcomes for men. On the flip side, there's also men who are trying to get help, but they're not necessarily receiving the help that is catered to their unique needs. So this whole problem hasn't really been discussed, and the report really tries to shine a light on it and to show that in Canada, this is a real issue that's impacting us on so many different fronts and impacting Canadians from coast to coast to coast, whether you're a man yourself or a caregiver or a friend, a cousin, a partner, and so on, because the reality is we all know someone who's impacted in some way by this. So the report shows all this, but is also calling for systems change, because despite this being a very critical problem, there is an opportunity here for Canada, just like in Australia and in the UK, to really implement a gender-responsive national men's health strategy that responds to the unique needs of men.
Okay, so before we get to that response, let's talk about here in Manitoba. There are 2 places here in our province where we're seeing higher numbers than the national average. Tell us about that.
Yeah, so there's 2 ridings that are part of the top 5 ridings in the country with the highest mortality rates. Winnipeg Centre and Churchill-Quintinuc-Aski are both part of it. So the reality is that where you live in Canada tends to determine also how long you live if you're a man. That has to do with, you know, where you are physically located, what kind of resources you have, access to healthcare, literacy, engagement in risky health behaviors and gender norms. In some parts of the country, that's intersected with trauma or culturally specific realities that lead to men to either not engage in the healthcare system, or when they do engage, being dismissed or not really listened to, or not having actually the appropriate resources for them to sort of do something about their health. So unfortunately, Manitoba has quite a high prevalence of premature mortality. Yeah.
So I guess the message then is don't ignore your symptoms and seek help when you can, as soon as you can.